Hi everyone, welcome back. We hope you had a great week and weekend. In last week's session, we discussed home safety, proper body mechanics, safe transfers, and use of adaptive equipment when performing everyday self-care skills, such as when in the bathroom showering or using the toilet. As we transition into this week's session, I would like to begin with a self-reflection. I want each of you to think to yourselves, do you have a healthy routine you stick to? What do you do to stay healthy? Feel free to write down your thoughts. However, no sharing is required at this time, as it is simply an activity designed to get you thinking about the ways you maintain your health. This leads me into our first topic of health management and maintenance, and the topic of home establishment and management that will follow. Health management and maintenance and home establishment and management are two occupations that fall under instrumental activities of daily living, or IADLs. IADLs are activities to support daily life within the home and community that often require more complex interactions than those used in activities of daily living, or ADLs. By the end of this session, our objective is to identify high-risk fall medications, categories of physical activity and how to incorporate them into everyday life, to learn recommended nutrition and hydration amounts to reduce the likelihood of falls, to learn how low vision can contribute to falls, to identify outdoor hazards, how to remain safe while maintaining the home, and lastly, to demonstrate examples of physical activity you can add to your health maintenance routine. Medication use is common among older adults over the age of 65. It's important to know about your medications to avoid possible problems that can occur from either taking more than one medication or simply from medication side effects. There are high fall risk medications that you should be aware of, and reviewing your medications and engaging in medication management can reduce interactions and side effects that may lead to falls. Keeping track of how your mind and body feels after taking medications and sharing this with your doctor can help you become more aware of how your body responds to medicine and can help you prevent possible falls that can occur from drug interactions and side effects. 3 types of medications that may contribute to falls are antidepressants, benzodiazepines, and anticholinergics. However, reducing the absolute number of medications, utilizing the lowest effective doses, and eliminating medications specifically associated with falls can help reduce your risk of falling. If you are thinking to yourself that you take any of these medications and are concerned about your medication use, please consult with your doctor. In addition to medication management, physical and mental fitness is a second component of health management and maintenance. Maintaining a mind-body balance and staying physically and mentally active is important to reduce risk for falls by improving balance and awareness, and can contribute to an increased quality of life, health, physical function, and improved safe participation in meaningful everyday activities. So how often should you be performing physical activity, and what types of activities can you do to stay active? It is recommended that a combination of aerobic, strength, and balance exercises should be performed 150 minutes per week, or 30 minutes of physical activity 5 days a week. Physical activity includes any movement to the body. This means you do not have to go to the gym to be considered physically active. There are many day-to-day tasks that you likely already perform or can perform to expend energy and thus be active. Examples of aerobic activities are activities that build your endurance and help you maintain energy for longer periods of time include dancing, swimming, walking, biking, walking a dog, tennis or walking in golf, yard work, cleaning, or walking in a park. Strength activities or activities that provide resistance to your body to build muscle and make you stronger include digging, lifting and carrying when gardening, carrying groceries, carrying laundry, or shoveling snow. Balance activities or activities that improve stability and help you keep upright include weight shifting, bending and reaching when cooking, dancing, or getting in and out of a chair. Physical activity can also be movements using exercise bands and weight machines, or is the performance of body weight exercises. Although 30 minutes of physical activity is recommended to be performed 5 days a week, Physical activity does not have to be performed in a continuous manner for 30 minutes. Please feel free to break it up. Spend 10 minutes in the morning, afternoon, and evening performing some form of physical activity to get a combined total of 30 minutes of physical activity for the day. Why should we be physically active? Physical activity has many benefits and is associated with improved mental health, emotional, physiological, social well-being, and cognitive function. Two forms of exercise that not only increase physical and mental fitness but can be enjoyable as well if they are of interest to you are yoga and Tai Chi. Both yoga and Tai Chi should be performed 2 to 3 times a week for a total of 10 to 20 minutes each or more to reap the most benefits. So what is Tai Chi? Tai Chi is a graceful and gentle form of exercise that involves movements performed in a slow, focused manner accompanied with deep breathing. What is yoga? Yoga uses a variety of poses that are performed slowly and are synchronous with breathing exercises. Remaining physically active in a way that is most meaningful for you is essential for optimal health and well-being and continued participation in everyday occupations. I'd like to now discuss nutrition and hydration. Older adults are at risk of inadequate nutrition, and the development of malnutrition can lead to various health concerns, including poor wound healing, fatigue, muscle weakness, and decreased bone mass, which can lead to falls and fractures. Furthermore, weight loss can result in a loss of muscle and bone, leading to poor balance and increased risk of falls and fractures. It is evident how vital it is to maintain adequate nutrition and hydration. So how much of what should you be ingesting each day to best support your health and reduce your chances of falling? Reading the nutrition facts labeled located on the back of food boxes and cans can help you determine the amount of intake you are getting for protein, calcium, and vitamin D. As you can see, the label lists the amount of protein, calcium, and vitamin D you are receiving from ingesting that particular food. Relative to hydration, age-related changes such as decreased kidney function, conscious decision to restrict fluids due to incontinence, and a diminished sense of thirst increases risk of dehydration. Orthostatic hypotension, or a drop in blood pressure when standing, can cause dizziness and increase fall risk as well. In order to maintain adequate fluid consumption, it is recommended that women drink 9 cups of fluids and men drink 12 cups in order to best prevent falls. If drinking water is difficult for you, or if you simply prefer not to drink water, feel free to refer to these tips to drink more and stay hydrated. There are many sources of fluids besides water. As one example, try eating foods with high water content to increase hydration, such as cucumbers, lettuce, celery, tomatoes, bell peppers, watermelon, strawberries, melon, oranges, and apples. Keep water close by bringing your favorite portable water bottle with you throughout your day. Take small sips throughout the day rather than an 8-ounce glass of water during every mealtime. Mix in other liquids into your diet in addition to water, such as tea or a 50-50 mixture of juice and water. Add flavoring to water using flavor packets or lemon or seltzer water if that appeals to you more. Stay hydrated with a friend or family member, as having someone else track or increase their water intake with you is more motivating and will keep you accountable. One last aspect of health maintenance that significantly contributes to fall risk is vision. Low vision or visual impairment increases risk for falls and decreases an ability to manage health, the ability to prepare nutritious meals to manage health, all transportation including to and from clinic visits, and medication adherence and management such as reading pill bottles and ordering refills are all impacted as well. Furthermore, low vision impacts our instrumental activities of daily living, including shopping, driving, and community mobility, which we will dive into next week. The most common types of low vision are loss of central vision, loss of peripheral vision, night blindness, blurred vision, and hazy vision. These types of low vision are more commonly referred to as age-related macular degeneration, glaucoma, cataracts, and diabetic retinopathy. Let's take a look at what each of these conditions look like from the person's point of view. This is what normal vision looks like compared to what someone with age-related macular degeneration sees. This is what normal vision looks like compared to what someone with glaucoma sees. This is what normal vision looks like compared to what someone with cataract sees. Lastly, this is what normal vision looks like compared to someone with diabetic retinopathy sees. There are simple strategies that you can utilize in your everyday life to compensate for low vision and increase participation in activities you want to or need to do. Here are some strategies you can utilize to compensate for low vision. Use brighter lights by installing LED lighting and lamps for close activities and fluorescent lighting for general room lighting. Use a handheld magnifying lens or lighted magnifiers for reading and other close-up activities. Increase edge contrast sensitivity by using brightly colored fluorescent tape on edges in the home, such as stair edges. Wear anti-glare sunglasses and use high-plus reading lenses or multifocal glasses. Multifocal glasses are helpful for activities requiring a change in focal length, such as driving, cooking. However, you should wear multifocal glasses only when needed, as evidence shows it distorts depth perception and contrast sensitivity and consequently increases risk of falls, which is what we are trying to avoid. Your glasses should also be checked every year in order to maintain an accurate prescription. Attending an annual eye exam and making it a part of your health maintenance routine is important to monitor vision changes and make sure you are as safe as possible when navigating your home and community. We will now transition into home establishment and management. Safe and mindful participation in managing the home is important for reducing fall risk and thereby supports continuous participation in everyday activities. Identifying the ways you take care of your home and using strategies to safely do so can help you prevent falls and reduce your risk of falling while continuing to maintain your home as you age. What can you do to combat falls while maintaining your home? Inspect your entryway and walkway for cracks and uneven surfaces. Look for leaks around toilets, sinks, and bathtubs. Maintaining proper body mechanics and positioning and using energy conservation tips can help reduce fatigue and risk for falls while maintaining the home as well. Here are several examples of how to perform proper body mechanics and tips for energy conservation. Sit in a chair while performing activities as opposed to standing. Take a 10 to 15 minute break in the middle of tasks. Keep feet flat and shoulder width apart when standing. Pivot on heels and toes with knees slightly bent when changing direction. Avoid twisting at the back and maintain a diagonal stance of one foot in front of the other while pushing and pulling objects, especially when performing cleaning tasks such as mopping. Use a basket or trash bin and keep it nearby when retrieving objects or putting away materials to avoid walking long distances. When picking up an object, bring the object close to the body or bring your body close to the object. Bend at the knees and hips and breathe out when lifting. If enjoyable to you or of interest, one outdoor activity that you can do to reduce falls is gardening. Participating in gardening improves balance, gait speed, and leads to fewer chronic conditions and functional limitations, as well as reduced reporting of falls. To end our session today, our friend Gertie will perform various strength, balance, and aerobic exercises that you can follow along to or perform at a later time and add to your health maintenance routine. She will also demonstrate the balance challenge of the week that we encourage you to perform at home, as we will be going over it in the beginning of next week's session. Lastly, I will explain the homework assignment that we will additionally discuss in the beginning of next week's session. Terminology that is useful to know prior to performing the exercises are the terms repetitions and sets. A repetition is the number of times you perform a specific movement or exercise, and a set is the number of cycles of repetitions that you complete. I encourage you to perform 2 sets of 8 repetitions for all of the exercises besides the flutter kicks as well as the balance challenge. However, this number is not required. Listen to your body and perform as many as you can to the best of your ability. Here are 2 strength-focused exercises. One requires a dumbbell and one requires a light-weighted ball. The first strength exercise is a knee lift with a ball. Sit in a chair with feet flat on the ground, shoulder width apart. Hold a light weight or medicine ball in both hands straight up over your head. Lift the right knee up to waist level while bringing the arms down, touching the weight or the ball to the knee. Lower the right knee and take the ball all the way back up overhead. Now, lift the left knee to the hip level, Bring the ball down to the knee. Return to start and repeat, alternating sides. Continue for 30 to 60 seconds. The second exercise is a squat to diagonal twist. Stand with your feet shoulder width apart. Hold a dumbbell of preferred weight with both hands out in front of you at chest level and the elbows slightly bent. Perform a small squat by pushing the hips backwards, keeping your weight in your heels and slowly bending the knees. Keep your eyes, knees, and toes aligned and maintain a straight back. This should look as if you're going to sit down in a chair. Stand back up and rotate your body to the right side. Repeat squat and rotation on the left side. Here are 2 strength-focused exercises using resistance bands. The first strength exercise is a seated banded row, which requires the use of a resistance band with 2 handles. Sit in a chair with feet shoulder width apart and your back straight. Place the band under each foot and have both feet flat on the floor. Grab the handles with both hands and keep your arms relaxed at your sides. Keep elbows close to your body and pull the handles back. Your elbows should form a 90-degree angle on both sides at this point. Squeeze shoulder blades and hold for 2 seconds, then release and relax your arms and repeat. To modify this exercise, please feel free to eliminate the 2-second hold or position your feet so they are touching each other rather than shoulder width apart. The second exercise is standing shoulder pull-aparts with side step, which require the use of a TheraBand without handles. Stand with your feet shoulder width apart. Use both hands to grasp both ends of the resistance band. Using both hands, raise the band to chest level out in front of you and pull apart the band so each hand is pulling in opposite directions. Hold the pull-apart position for 2 seconds while taking a lateral step to the right. As you bring your hands back to the center of your body, step back to center where both feet are shoulder width apart. Repeat pull apart and lateral step with opposite side. The next 4 exercises require you to be in a pool to perform. The first 2 exercises work on the aerobic system. The first aerobic exercise that Grady will show you are jumping jacks. Start with the feet shoulder width apart and hands at your sides. Simultaneously raise both arms at your sides to above your head and jump outwards with both legs. You should be in an X position. Simultaneously bring your arms back to your sides while jumping with the feet back to center. The second exercise that Grady will show you are flutter kicks. Grab a kickboard, enter the water, and place it in front of you. Position the kickboard in front of you at an arm's length away from the body. Lean forward, grasp the kickboard with both hands, and flutter kick your legs to propel you forward across the pool. Your legs should be straight with a small knee bend, toes pointed, and your legs should be alternating. Keep your feet from touching the bottom of the pool. Perform the exercise at a distance of 10 feet or until you reach the other side of the pool. I encourage you to propel a forward distance of 10 feet or more for a total of 2 times. However, listen to your body and perform the exercise to the best of your ability. The next 2 exercises that Grady will perform are in the pool to work on balance. The first balance exercise is arm and leg water marching. Stand with your feet shoulder width apart and arms at your sides. Perform a marching motion by raising the knees upward to the ceiling as high as you can and alternating the legs. Once you are able to perform the lower body movement, add in the upper body movement. Raise one arm straight out and forward with the palm facing down and push downward into the water until the arm is touching the side of your leg. Alternate arms as you march with the legs. To modify this exercise, eliminate the upper body movement or hold your arms straight out at your side for balance as you perform the lower body movement. The second exercise that Grady will perform is a chest fly with a forward lunge. Begin with the feet shoulder width apart and both arms straight out at your sides so your arms are hovering at the water surface. Step forward with the right leg into a small lunge with the knees slightly bent, maintaining a tall and straight posture. Position both hands with palms facing forward and bring your hands together, keeping your arms straight. Bring both arms back to the initial position. Repeat the upper body movement with the left leg. The balance challenge for this week is called a forward bend. Sit in a chair with a straight back, feet shoulder width apart, and hands relaxed on lap. Take both hands and reach forward until you touch the ankles. Once the ankles are touched, slowly sit back up and bring your hands back to your lap. Feel free to try another variation of this exercise. Maintain the initial position as observed in the first variation of the exercise. However, instead of bringing your hands down to touch the ankles, take your right hand and reach to touch the left ankle. Repeat with left hand and right ankle. To modify this exercise, reach with your hands to touch your knees instead of your ankles to reduce the distance required to bend forward. The homework assignment we encourage you to complete prior to next week is a water intake tracker. As we discussed today, it is recommended that women drink 9 cups of fluids a day and men drink 12 cups of fluids a day to best prevent falls from occurring. I challenge you to record how many cups a day you drink for the next week. For some of you, this may be difficult to achieve, and for others it may be easy depending on your current intake. Regardless of the level of difficulty, we encourage you to do your best, as that's all that matters. Thank you for your engagement in today's session. We look forward to hearing from you in regards to the Homework and Balance Challenge, and we will see you next week. Have a great rest of your week and weekend.